Good afternoon, everyone, and thank you for joining us for today's timely webinar. I'm Karen Yarhimilo. I'm the Dean of SIPA and the Adlai E. Stevenson Professor of International Relations. And on behalf of SIPA and the Institute of Global Politics, I am thrilled to welcome you and introduce today's guest speakers. I want to first say how important it is that this conversation is happening at SIPA in partnership with IGP, because as the title of this webinar affirms, global health is a matter of global politics. When we come together to discuss global public health, we understand that we're not really simply talking about medical realities. We immediately understand that we're talking about the political factors and decisions that determine health outcomes for our communities and for the people around the world. Our conversation today will be moderated by Secretary Hillary Rodham Clinton, Professor of International Public Affairs here at SIPA and IGP Faculty Advisory Board Chair. As First Lady, as U.S. Senator, Secretary of State, she knows firsthand the importance of understanding that health is directly related to political decision-making. You know, when she was first Secretary of State, she pointed out that some might ask what global health has to do with foreign policy. And she said, my answer, she responded, is everything. Global health has everything to do with foreign policy, whether we're talking about bird flu season or vaccination drives, humanitarian work, or other urgent concerns. These connections between global health, foreign policy are what the speakers today are going to be talking about. Secretary Clinton and I, we co-founded the Institute of Global Politics to address pressing global issues, and really none are more pressing than those our speakers will be discussing. I'm really glad that we have this opportunity to talk about this. I know there's a lot going on. This is such an important topic. So before I turn the conversation over to Secretary Clinton, let me introduce our distinguished speakers. With us today are Wafaa El-Sadr is the Executive Vice President of Columbia Global, Chair of the Global Health at Columbia University, the founder and director of Global Health Center, ICAP, at Columbia University, and she is also university professor in epidemiology and medicine. She is one of the world's foremost expert in global health and infectious diseases, with long-standing experience and expertise in supporting diverse major health challenges around the world. Wafaa has dedicated her career to advancing public health knowledge and putting that knowledge into action. We're really grateful that she's with us and for everything that she's been doing at Columbia and beyond. We also have with us Jennifer Cates. She's a Senior Vice President, Director of Global Health and HIV Policy at KFF, where she oversees policy analysis and research focused on U.S. government's role in global health and the global and domestic HIV epidemics. And thank you so much, Jennifer, for being with us. We also have Michel Kazatchkine, who's the former executive director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and an inaugural IGP, Carnegie Distinguished Fellow. Previously, he served as the UN Under-Secretary General and Special Envoy for HIV/AIDS in Eastern Europe and Central Asia. And since 2018, he has been a special advisor to the joint UN program on HIV and AIDS for Eastern Europe and Central Asia. Thank you so much, Michelle. It's great to see you again. Last but not least, we have Apoorva Mandavilli. She's an award-winning science and global health author in the New York Times, which she wrote about infectious disease and public health. She also was the founding editor-in-chief of Spectrum, an award-winning news site on autism science before joining the New York Times in May 2020. Thank you so much for all of you for being with us. Look forward to the conversation, and thank you all for joining us virtually. Secretary Clinton, the floor is yours. Thank you.
Thank you very much, Karen. Thanks for those introductions, and welcome to all of our panelists. Each of these panelists has been on the front line of global public health efforts to combat infectious diseases from HIV/AIDS to COVID-19, as well as other health threats. So I want to open with two framing questions. Michel, you have spent more than 30 years promoting global health as a physician, a researcher, an advocate, a policymaker, a diplomat. You've worn many, many different hats. Give us just a quick overview as to how you have seen global health evolve over the past several decades and why it is a matter of global politics, and very importantly, where you see its status now in the current global political environment.
Well, thank you very much. Thank you, dear Secretary Clinton, Hillary, and thank you to IGP for convening this event. And I'm absolutely pleased to join Wafaa, Jen, and Apoorva today as well. What is global health? Let me say, here in Geneva, we use the following definition for global health. Global health is about health issues that transcend national borders and require a collective action of the international community to respond to them and to address their root causes. So first, my first point would be that global health is about our interdependent world and a common determination of the international community to act together. This also means that no one nation, how powerful it may be, can solve these challenges by itself. So pandemics, including COVID, Mpox, bird flu, and actually most health security related issues are obviously in this category of global health issues. HIV, tuberculosis are other remarkable examples of global impact and global collaboration, in which I would like to add that the US have had a remarkable leading role for over 20 years, and this has been our common fight with Wafaa and Jen. But antimicrobial resistance or the health impact or climate change are other global health issues. And so is the global epidemic of obesity and diabetes type 2. We need a global agreement on sugared drinks to address global obesity, not only fragmented and inconsistent national policies. Just as 20 years ago, the world had agreed to address the harms of tobacco with a global treaty on tobacco control, which the US had ratified. So global health is not something we can perhaps afford to spend money on only if we have covered our domestic needs and feel in a charitable mood. Global health is also investing in one's own population's public health by recognizing the global interdependent nature of pandemics and other global health issues. So that's about global health. But my second point is that if global health is global public health is indeed, I would argue, primarily a political issue at all levels of decisions, national, local, global, because it is about deciding on a specific public health strategy or funding public health. And that type of decisions is fundamentally political because it's about making the choice of health against other priorities, be them economic, commercial, or whatever other priorities. And finally, I would argue health is also a political issue because the occurrence, as Dean Karen just said, the occurrence and the outcome of a health event are framed by what we call determinants of health: social, economic, cultural, environmental, political determines, and how a government or how the international community address these determinants is based on political decisions. So thus, I would like to argue that there is no apolitical approach to public health. Global health is very much a political issue that will be significantly influenced by geopolitics. And that's what we're seeing now. Global health requires an effective multilateralism for governance, and we are in times where multilateralism is challenged. So to the very question of this webinar, how much is global health an issue of global politics? I was considering saying 100% last year when we started planning for this event. But this year, and in the current political and geopolitical environment, I would say 200%.
Well, I think, Michel, you have rightly framed the issue, and there at the end demonstrated unequivocally the importance of political will and political action. Let me turn to Jen, because Jen, you've been on the front lines here in this country, particularly with respect to HIV/AIDS. We know now that global health, just as our own domestic health, is a policy issue. How would you describe the current environment in this country when it comes to global health? And then, if you would, just speak to the connection between domestic policy and political decisions and health, both in this country and abroad, because I think, as Michel rightly pointed out, we are interdependent, whether some people wish to acknowledge that or not.
Great. Thank you, Secretary Clinton. It's really an honor to be here with you and all the panelists. I want to thank the ICP for inviting me to this. Great questions. I agree with Michel's summation at the end. You know, I've been working in this space for a very, very long time, and as many of us have here. And while I do agree that global health is political, it always has been political, I think for many, many years, particularly in the United States, which has been the strongest supporter as a donor, as a technical leader, as a implementer, as a healthcare provider in the global space, global health was able to enjoy being outside of the day-to-day political arguments and the fray that often would take over in Washington. And there were alliances that allowed that to happen. There were Republicans and Democrats that came together and recognized the importance of global health, creating PEPFAR, contributing and helping start the Global Fund to fight AIDS, TB, and malaria, and many other institutions. And for many years, that was the tenor of the discussion. There were certainly minor times when there'd be questions about the amount of funding for this or the policy direction of that, but it really never got pulled into the politics in a way that took over, as we often see on domestic health care battles. However, that has really shifted. And that's where we find ourselves today. And just in general, the way I've seen it, the two things that I think have shifted that, one is we've just had an increasing partisanship writ large. And that's not been specific to health or to global health or to any one issue. It's just been the nature of what's happening in our country, but around the world. And people are defining themselves in much more stark opposite terms that make it very difficult to come to the commonality that Michel talked about, that global health really is. Second, COVID-19. We cannot deny that the way that everybody in the world, including in the US, experienced COVID-19 was a dramatic shift and created a dramatic shift in how the public, that usually doesn't think about public health or about the role of the government in public health, had to deal with that on a daily basis. Everybody, we all did. And it led, for a whole range of reasons, led to mistrust, fear, feelings of encroachment, and lots of ramifications of that. Those two factors, the increasing partisanship and COVID-19, which of course also came together, unfortunately, have created a new environment for the discussion around global health in the United States. And it is a partisan issue now, when it never was. Even PEPFAR, which still enjoys support, has become a partisan issue. And this is just a shift that I do not necessarily think we'll get away from. I think it's just a change that may be permanent. And I know we'll talk later about some of the specifics. So I'm just going to go to the second question around the connection, though, between global health and domestic health and domestic policy. I think most people, and COVID probably changed this, would think global health has nothing to do with me. That's something that happens outside of this country. It's something that, I don't need to know about. And in fact, I question why my government spends money there. And that's often what we hear, especially now. But of course, when we think back on the history of, let's say, US engagement in global health, it actually started in the late 1800s when, because of increased commercial activity and shipping, diseases were coming into our country and back and forth. And there was a collective need to respond to protect people. That was the origin, really, of cooperation. And it only increased from there. And I think that as, we're with globalization at the level that we all live in, people, pathogens, information are moving fast all the time. And that just means that infectious diseases, they spread. I mean, I was thinking before this seminar about the current measles outbreak, which started from imported cases and is spreading in the United States because people who are unvaccinated have become infected and are getting on planes and going to Washington, D.C. at Dulles Airport, or going to Philadelphia, or going to an adjoining state. That's how diseases spread, and that happens across borders. So it really, infectious disease and global health really is a domestic issue. How politicians choose to address it is a different question, but it's definitely the case that it affects all of us. And when you have weakened local public health systems and weakened global public health systems, it really increases the risk that we will see more pathogens and outbreaks of previously of novel pathogens, as well as ones that we thought we had under control. So that's how I see the current state. And unfortunately, I hope that isn't the case, but I think all of us who work, particularly in infectious diseases, know the likelihood of another outbreak is close to 100%. It's just a question of when, how large, and how deadly. Thank you.
Well, Jen, thank you for that overview, which I think is sadly very accurate. Wafaa, you have spent your distinguished career advocating for those who are impacted by health inequities. You've championed a collaborative, multidisciplinary approach to confronting the global HIV/AIDS epidemic. And really, whether you're talking about HIV/AIDS or measles or bird flu or any other existing or future health challenge, how do we, going back to what Michel said, foster collective action in this current political climate where there is so much mistrust and partisanship, nationalism, and frankly, lack of trust and belief in science?
Thank you very much, Secretary Clinton, and it's an honor to be with my colleagues today. That is one tough question, I must say, and I think if I had the solution to this, I would willingly share it, but I'll give you some of my thoughts. I do think that we need to think both at a high level, but also at a grassroots level in terms of how can we get to a collective movement that tries to depoliticize health overall, and whether it's domestic health or global health. I think we need to work at all different levels of society to be able to almost get a new momentum, a voice, a momentum that says that this is for the collective good, but it's also for self-interest as well. And clearly the example of infectious disease, as many of you have said, are highlight this, why it's important for our collective well-being. I think whether it's, as was mentioned, SARS-CoV-2 or also tuberculosis or HIV or Mpox, I think we've learned that viruses do not respect borders, and that today it's estimated that about 15 million people a day take air travel, use airplanes, and it's every single day. So we are an interconnected world, and it's inevitable that what happens elsewhere around the world will be in our own backyard very, very quickly. And in addition, of course, we have hosts that travel. Certainly, bird flu has been transmitted by birds, which travel between many different continents. So the importance of kind of appreciation, that people appreciating that you can't build walls around yourself, around your community, around your country, that we are, whether we like it or not, we're interconnected through people and through other vectors as well. I also think that an important aspect of trying to think ahead is to keep on highlighting the importance of sharing of resources so we can protect each other. And that became very evident during the COVID-19 pandemic with the whole issue of sharing of vaccines and treatments. And again, sadly, the hoarding of vaccines by certain countries and then other countries deprived from these innovations. And in a way, it hurts everybody, because if you cannot protect people elsewhere, that leads to replication of viruses, new variants, and then they come back to the other country around the world. And then I think the other issue that I think we don't talk about as much is we are very worried about outbreaks and pandemics and the whole area of preparedness. How can we be prepared collectively? And that may be another way of trying to bring people together. So we don't need to go through the trauma of COVID-19 if we are better prepared collectively to try to respond to the next health threat. That means we have to put in place strong data surveillance systems. We have to train people. We have to invest in laboratories and data systems and do collaborative research across borders as well. So there are critical pieces of knowledge and information that we need to be able to effectively disseminate and somehow find the right channels, the right champions that can help us disseminate this information in terms of why this is important and why everybody should be concerned about it, not just the recipients of the services themselves, but everybody should be concerned about it. I do think that when I was thinking back, like maybe 10 years ago, I remember visiting a health facility in rural Tanzania, a very remote health facility in rural Tanzania, and having a conversation with a group of people, farmers largely from that community. And I will never forget this farmer, a simple man who stood up and he told me directly, I want to thank you, and I want you to thank the American people because you brought me a lifeline. I can now live and work and take care of my family. And please do transmit my appreciation to the generosity of the American people that have enabled this to happen. And then sort of he stopped and then he said, is there any chance that this will go away? And it was kind of a shocking question at that moment. And maybe I'm an optimist. I said, no, there's tremendous commitment. There's a bipartisan commitment. This is we're here with you for the long term. So I do think that in order to be able to get a movement that tried very hard to try to depoliticize what's happening on the ground, we need to work at the grassroots level, as well as to work, of course, at the political decision-making level. And I think by just focusing on the political level and the high level and the governance level, I think we may make progress, but I do feel like it's time now to mobilize a grassroots movement that tries to say that health overall and global health are absolutely critical, and they are for our collective well-being as well as for our self-interest.
Thank you so much, Wafaa. And, when you gave that answer 10 years ago, it was true. It was a true answer. And as Jen has reminded us, there was a very strong bipartisan alliance supporting global health. I saw it when I was in the Senate voting for it. Voting for PEPFAR, which was George W. Bush's creation. I saw it when I was Secretary of State, traveling the world, helping to implement and improve our programs and the delivery and implementation of aid. So you were absolutely on strong ground then, and then the ground shifted, and I think Jen pointing out both hyperpartisanship and the lingering effects of COVID-19 and the attitude among some currently in government or at high levels advising government that empathy is a weakness really add up to where we are finding ourselves today, and how we sort of dig ourselves out of this hole and stand on firm ground again is really what I hope we can continue to talk about and work on, most importantly. Apoorva, you as a journalist, and before that as an activist, as somebody involved on the front lines, have been watching these changes in the politics and policies of the United States and how that ripples across the world. The cuts at USAID, the cuts at HHS, the cuts at CDC. Can you perhaps put those into context, that it's not just about what we should and have been doing to help others. It is very much how helping others redounds to the health benefits of our own citizens. So, talk about how the current administration's views influence infectious disease threats, what that really means.
Thank you, Secretary Clinton. It's an honor to be here, and I've had the pleasure of interviewing all of my fellow panelists before, so this is really great for me to be able to talk this directly. I do want to clarify that I was never an activist. I've always been a journalist, so let me just put that out there. But I do think that there is...
I didn't undermine your credentials, but I view you as a very important journalist who maybe led others to take action. How about that?
I can take that. I can work with that. Yes. I do think that there has been some confusion in the last few weeks on what has even been cut. As a journalist, it's been really difficult to even figure out what is the most urgent thing to cover right this minute, because the cuts have been coming so quickly, so fast and furious. It's hard to know, what is even being cut abroad and in the US. Sometimes people find out about the cuts from me when I call them to say, have you heard about this? And that's the first piece of information they've had about it. The CDC, you just mentioned the cuts at the CDC. That's a perfect example. Some of the people who were being cut had no idea which divisions were being cut, and they were finding out from us journalists who were getting it from various different sources. So infectious diseases across the board, HIV, TB, malaria, I think they are all under threat. But I wanted to talk for a minute about bird flu, because I think that's one that really illustrates what you were just getting at, which is, this with HIV, TB, and malaria. I think there is sometimes a sense among Americans that those are problems that affect people over there. They don't affect me. They will not affect me. And that's definitely not the case. But I think bird flu is one where that's even more clear in a more urgent way. And unfortunately, it's really flown under the radar the last few weeks, in part because it's not high migration season. And so we're not seeing as many cases at the moment, but that's just a matter of time. Now we're entering the high migration season again for birds. And so we're going to see more cases. But just in the last few weeks, we've seen deaths among children in India, in Mexico, in Cambodia, and it's very much a threat. And one of the big cuts in the USAID sort of hackathon was to the Food and Agricultural Organization, which was doing very valuable work in about 49 countries, keeping track of bird flu and helping farmers on the ground identify what they needed to do to prepare for the threats, to secure their farms. Doing outbreak investigations. Last year they did something like 180 investigations of outbreaks in 22 countries. So this is an organization that has done very important work on the ground, getting us ready to detect an outbreak, and that money is now gone. And even domestically, it does not seem like this is a big priority for this administration. When there has been a conversation about it, it has been in terms of the price of eggs. The price of eggs is affected, and so we will import eggs from such and such place, or there has been some talk about biosecurity for poultry, But cows, dairy cows, which have been seeing an outbreak for over a year, are not even really a part of the conversation. We're not really seeing talk about how to prepare in case there is an outbreak among people, which, you know, the scientists I talk to tell me could happen any minute. It's really just a matter of luck that we haven't gotten there yet. Could happen never, but it could also happen next week. And we're not really seeing conversation about this is how hospitals would prepare, or this is how we would test everybody, or, you know, this is the state of the vaccines at the moment. In fact, we have an HHS secretary who's not really a very big fan of vaccines and has called the vaccines that are in the stockpile dangerous. He has also suggested letting the virus sort of run wild among poultry in the farms to see which chickens might survive. Well, veterinarians will tell you no chickens survive when H5N1 goes through them. They all die, gruesome deaths very quickly. So there's the sense that this threat is just not being taken very seriously. And I can tell you that in press briefings, CDC has not had one at all, actually, since the new administration, but even before, and in conversations with the USDA, it's always, the emphasis is on we're not making anybody do anything. And I think that's where Jen's point about COVID really having this sort of hangover effect of we don't want to have any mandates. We don't want to tell anyone what to do. We don't want to even force anybody to get tested, even if that's in the public health interest. So that comes to the forefront before, you know, these are the steps that we are taking. Everybody is so nervous about going too far in terms of the measures taken that they're not taking any at all, is my impression from these conversations. And so that is extremely, I think, important to note that we are not really prepared, or mentally, let alone in terms of logistics. We were also hearing, in terms of TB, and a thing that maybe Americans don't think about themselves as being at risk at all. We were hearing that the administration was considering invoking a law that would help them sort of stop people from coming in at the southern border in case they had TB, because that might be a threat to Americans. Well, I think that plan might have been shelved, but certainly cutting TB services and programs across the world, that's the best way to ensure that TB will actually come to Americans. And so that math is not really being talked about anywhere, that connection will definitely happen. And one thing I also wanted to mention, Wafaa was talking about Tanzania. These community workers that USAID was helping to fund, because they funded logistics for all of these infectious disease programs that we had. The community workers were the ones who were transporting samples, who were driving the trucks, who were delivering things, and all of that has now gone. And we know, for example, that in January, the Tanzanian government said that they did not have a Marburg outbreak. They denied it at first. And it was a community worker who a week later saw somebody come in with unusual symptoms, flagged it. And so that's how we knew about the outbreak. Now you've lost these sentinel people who are the first ones who are going to see something wrong and raise the alarm. And that makes it much harder for us to know whether it's bird flu, whether it's another Marburg, Ebola, even if it's just drug-resistant TB. We've just really lost the ability to know that these diseases are happening, that we need to pay attention and get ready.
Well, Apoorva, thank you for focusing on bird flu, because you're absolutely right. It's been sort of under the radar screen as it has continued to spread and caused the killing of flocks and herds and things like that are actually going on in the so-called real world, but are not breaking through to the public because there's no public health strategy that is being promoted. Thank you for reminding us of that. So, Michel, we know there is a concerted attack on global health governance. We saw this administration attempt, I don't think it's been fully implemented, but attempt to withdraw from WHO. We've seen them, basically refuse to continue funding Gavi and other global health mechanisms. How do we address that on the global level? How do we keep these organizations going and performing while we try to deal with the very difficult political environment here in the United States?
Yes, thank you. That is a huge concern, of course. If the starting point is that, as we've been discussing so far, global health issues require a collective response of the international community, then it requires an agreed and effective global health governance. And that, I would first argue, would start with an effective World Health Organization, because WHO plays this essential role in surveillance and coordinating global response efforts to infectious outbreaks in preparation, what Wafaa was discussing a few minutes ago. WHO's mandate is also normative. It recommends the world what are the best strategies and policies for prevention, for treatment based on scientific evidence. And the World Health Assembly, which brings together the ministers of the 194 member states of the World Health Organizations. The World Health Assembly can approve international regulations with international obligations, such as, for example, the obligation that was largely discussed in the early days of COVID of reporting on a public health event that could become an international threat. And further, WHO can negotiate, as I mentioned earlier, legally binding treaties such as the Framework on Tobacco Control, or let's see what happens, but the pandemic agreement that is currently discussed in Geneva. So I really believe it is in the self-interest of the US to participate in global health governance, and I think that the announced intention of the US to withdraw from WHO can only be a threat to the US health security and to global security. But global health governance, as you mentioned, Secretary, is not just about WHO. It's also about all other UN agencies such as UNICEF, UNDP. It's about the Global Fund. It's about Gavi and many institutions and partnerships that operate in global health. But the common denominator to the governance of all these institutions is that it is multilateral. And multilateralism today is challenged by a very divided, very polarized geopolitical landscape. And that has been further exacerbated by the positions now taken by the US administration. I'm not saying that the current system is perfect and fit for purpose. I think everyone would agree that global health governance and what we call the architecture of the global health ecosystem need to be reviewed and reformed, and that the reforms are too slow and too limited in scope, and that the changes that WHO will initiate in the coming weeks under financial pressure will not be sufficient. We need a refoundation of the system. How and when will this take place, I think is unclear to us, but what is clear to me is that an effective and equitable global health system should be based on the common understanding and commitment of all nations, based on rigorous scientific evidence and framed in the respect of human rights. We hear a lot these days about competing interests, but far too little about the importance of identifying shared interests. So I don't know what will happen in the next few months, but I really sincerely can only hope that the US, with its historic values and wealth, extraordinary wealth of scientific and medical expertise, will soon re-engage in the international dialogue on health. You know, at this end of the ocean, Atlantic Ocean, we feel like we've lost a friend for now.
Well, Michel, I hope it's just a temporary breach of friendship for all of our sakes. But we can't just hope that it renews. We have to work to make that happen. And I think your sober assessment is a really important benchmark against which we have to try to once again respond effectively. So from Michel's perspective, Jen, to yours, you know, as we just heard from Apoorva, I mean, people on the front lines of of public health in our own country often don't know that their jobs are being eliminated, that their offices are being disbanded, that the funding is being halted. And certainly we have seen the dismantling of USAID, the very clear undermining of HHS, CDC, NIH, FDA, the list goes on. So where does that leave us at this moment? And can you perhaps reflect on what it will take to try to rebuild some kind of consensus about the importance of investing in health for our own interests, which I would argue includes global health as well as what occurs inside our own borders?
Yes, thanks. It is quite a moment. There are moments in your career where you look back and know something was very pivotal, and I would put the creation of PEPFAR by George W. Bush as one of those, where something happens, a political thing happens, and it changes everything. And there's many that I know Secretary Clinton you could point to and were involved in. What is happening now is, for opposite reasons, one of those moments. I think coming into when the administration started, many of us who work on foreign aid issues and global health expected change. In fact, the idea that foreign aid needed to be reformed is one that you actually looked at and led efforts to do. It is a long-standing issue in the United States, and it's not been solved. But what has happened, I would say, is not reform. What we've gotten is sort of a crash and burn. But take down the system and maybe build some of it up. But what parts we're not sure. So whether that was through initially an executive order that was issued on day one, the president calling for a foreign aid review, again, a good thing. We should review how the U.S. spends money, the taxpayers' money. But how that got operationalized was really to tell all implementers across the entire foreign aid portfolio, global health, food aid, humanitarian assistance, stop what you're doing, even if we've already paid you, even if we owe you, don't do anything. We are halting it all while we do this review. And this created, as you can imagine, chaos and confusion and concern. But mostly what I think we have to keep focus on is the people that depended on those services. What happened to them? And then the dismantling of USAID, which has been dismantled. I mean, the staff is by July 1, most of them will be gone. And I mean, this is where we are, and we could, we don't know yet what is left. I would say, there's some of PEPFAR left, there's some malaria programming left, there's some of bits and pieces, but other things are just wholesale gone because so many of the people and the clinics and the pipelines and the supply chains that existed had to close shop because they didn't have the money, or everything got disrupted. So what we're going to have going forward is a little bit unknown. At the same time, I think there are some opportunities. There is a need as we go into a next phase with U.S. government, Congress potentially coming more and getting more involved, to say, well, what are some healthy reforms that could be done in a way that preserves life and is done in a more thoughtful way. There's an appetite for it. Congress had been asking for this for years, especially of PEPFAR. So it's not like there wasn't discussion, but maybe there's an opportunity to pull that back a little bit and say, let's do it together in a way that allows these programs and the relationship with countries and especially the beneficiaries in those countries to get to live and to have livelihoods and not lose their life or become sick because of the U.S. pulling out in an abrupt way. So go from sort of a blunt, abrupt way to a more measured approach. And there was a hearing the other day on the Subcommittee on Appropriations on National Security and the State Department. Representative Diaz-Balart chairs that committee. It was on PEPFAR. And I'd say a lot of this kind of conversation was part of that hearing. And I think it was maybe a beginning sign that there might be some openness. The other bit that I do think resonates is this concern about infectious diseases and the threat to the United States. There is concern about it, and maybe that will allow for more understanding for cooperation as before it becomes urgent. But I just will add, and this isn't to be scary about it, but there is right now there was a global health strategy for the United States that actually President Trump developed under his first administration, and the Biden administration, revised, but starting with it and took it. Now the second Trump administration has said we're going to develop one, but we haven't seen it. And frankly, even if they went to take the one that the Biden administration left, it won't apply anymore because many of the offices and the people that it's predicated on are out of a job, don't exist, are being transitioned. And there's not, if there's an emergency tomorrow, there's really not a playbook that applies to the current environment in which in the government structure. So that says to me, let's hope there's not an emergency tomorrow, but it also will require cooperation with others. The US will need help if there is truly some kind of outbreak in our country or near our country. So I think that those, trying to find constructive ideas to move this forward, to talk about how the programs could look in the next few years. There's a lot of discussion about we can't do this forever. And I think that's right. And in most places, the US should not do this forever, but there's always exceptions. So what is that balance? And how do we put some criteria around that satisfy politicians who are hearing from their constituents that egg prices are too high, or that they're worried about their jobs and not understanding that spending a little bit of money internationally is good for them. Thank you.
Jen, I find that somewhat encouraging that there is at least conversation going on in the Congress. And I've had a couple of conversations with individual House and Senate members who are deeply concerned and have urged them to, look at some of the ideas that have been out there floating around. Because you're right, I was one of those who thought we could have done a lot more when we had the opportunity to reform and streamline USAID in a way that would have been more efficient. So I think there is room for cooperation. And Wafaa, I want to ask you, what role do you think a public health expert like yourself, or a very well-regarded institution like Mailman or the university and others in the public health arena could play in trying to come up with ideas that could be perhaps championed by members of Congress on both sides of the aisle? So there has to be some kind of development agency. It will be within the State Department. The day of an independent agency is over. And, that you can make a very strong argument that in and of itself is not a problem. It's how this was done, as you say, Jen, with a very crash and burn approach. But there is a role for public health experts, academics, others like yourself, Wafaa. How do you see perhaps participating in some way in this, we hope, conversation that we should both encourage and engage in?
Yeah, thank you very much. And I completely agree with Jen and with you, Secretary Clinton, is that over the years, there've been enormous learning that's happened when you think about through USAID or PEPFAR specifically. And these learnings are almost can be collated and brought together and can really catalyze a movement forward in an even better way, or more effective way, or more cost-effective way. I do think the way we've always thought about global health, and particularly the HIV response, is the idea of people coming together around the table and working together. And I feel like it's going to take academics or people like, who are in academia, or people who are in the policy space, or recipients of the services. It's really important we don't lose that vital component of our response. To come together, and people from the countries themselves. That is very, very important. We can't do it in the United States or US and Europe. We have to bring the people that have learned so much over the years and have a constructive discourse around what have been the lessons learned. They have a lot of ideas. They're full of ideas in terms of how things could be better, how they could be simplified, how they can reach deeper. We just have to enable this to happen and bring the different disciplines and constituencies together to be able to look at this systematically. And I do think there's a way forward here but it has to include the affected countries. It has to include the voices from the recipients of the services themselves and the researchers and everybody coming together. That I would say over the past 20 years, I think there's also maybe sometimes an underestimation of the magnitudes of the achievement and that have occurred. It's been truly transformative. And that's happened because of innovations. It's happened because people have been quite willing to embrace innovations along the way. This has not been kind of a cookie cutter type of programming across the board, whether it's in HIV or TB or malaria. It's changed, it's evolved, and it's evolved and changed based on experiences of people on the ground and based on research findings and so on. So we have a ready-made constituency or a group of constituencies that we have to figure out how we can pull this together and work with together in terms of finding a path forward that would enable us to make the changes that need to be made and bring in new innovations as well. I think another aspect of maybe that discourse that we often don't think about is what I call the local global learning and the global local learning. We have a lot to learn in order for us to tackle the key health issues in the United States or in Europe, for that matter, Michel, whether they be in HIV or chronic diseases and many, many other conditions or mental health or many, many other major health threats in our countries. We have a lot to learn from what has been accomplished in the countries that have received the foreign aid. Their ability to innovate and pivot and really define new models of care that the community health workers that Apoorva was talking about, the ability to bring in new discoveries immediately into the clinic, the ability to use data on a daily basis to shape programming and is novel and different. And we need to do that right here in our own country. And there's so many lessons that we can also distill from all the learnings, and that can help us in responding to some of the priority issues in the United States as well. So I do think that there can be a way forward if there's goodwill and an inclusive environment and the willingness to really tackle the hard questions together.
Well, Wafaa, as you were talking, I was thinking about one of the bright spots, at least thus far, with artificial intelligence has been in the health field. And we should think carefully how best to utilize AI in global health and see if there aren't some, as you rightly say, learnings that we could apply going forward. So I think this is a really rich arena for public health experts, academics, schools of public health, and others to try to get ahead of and perhaps, provide some real leadership. So thank you for that. Apoorva, as you have been covering these issues, what are you hearing from experts and sources about exactly how the U.S. retreat is already impacting people on the ground? Because we've been talking a lot about what could happen, what might happen, what is likely to happen, but things are happening right now. And it would be, I think, helpful for us and our audience to know that there's real world consequences that are not waiting, but are actually affecting people's lives. Yeah, I got on mute.
The situation is really horrific. I mean, in every country where there have been aid cuts, there have been massive, massive cuts to the programs. I think one thing that's been really missing from the conversation in a lot of these public forums is the idea that people are still not getting paid. There's still organizations that haven't gotten money. And so in theory, things have been restored, but for weeks and weeks, some of these tiny partner organizations on the ground were not getting any money, and so they've had to let go of people. And so even if you now say that this is now a grant that's been restored, the people are gone, the system is gone, and so that has had a really big impact I wanted to give you two very quick examples. One is I was in Uganda about a year and a half ago, where a different kind of political issue, religious politics, gave rise to this anti-gay law. Already a year and a half ago, things were really dire for these people, the LGBT populations in that country, because even having sex while being HIV positive is punishable by death there. And now with these programs that are cut, the few shelters that were remaining, the few clinics that were still able to provide treatment, they are also going out of business. They've shut down, and the community workers are gone, and that population is really, really suffering. The second one really doesn't have anything to do with infectious diseases, but is, I think, one that we can all agree is incredibly urgent, and that's acute malnutrition. There are kids who need these packets of malnutrition, the peanut products that are made. Again, those are grants that in theory are revived, but a lot of the manufacturers have not received money. And also the logistics that USAID funds, the shipping, the warehouses, the truck drivers, those have not all been restored. And so there is product just sitting around in various places that is not reaching these kids. I was in Nigeria, in northeastern Nigeria in November, and some of the camps that I went to then, so not even that long ago, are now shut down, either because they don't have product at all, or for other reasons. But then the camps that are open, where they're still giving them out, are overserved because people are coming from further and further away. And when kids are in that dire state of severe acute malnutrition, sometimes they only last for a few hours. And so when we hear about, no one has died because of this, that is absolutely not true. There have definitely been deaths. We just don't know how many, because the people who would normally follow up with those kids and find out why they haven't come in or what product they need, those people are gone. So we just don't have an idea of the actual impact, but the impact is there.
Something you just said, Apoorva, really resonated with me and is a great concern of mine, which is that there does seem to be a decision not to count. Don't do surveillance, don't collect data, don't know what's happening on the ground, keep people in the dark when it comes to the impact of these decisions. And that way, nobody will hold us accountable. So in addition to the reality that you are describing, I am deeply worried that part of the way that some of the decision makers are thinking about how to move forward is to try to cut off reporting and collation of data and preventing people from knowing about deaths or other kinds of morbidities. So I can't say this has been the most pleasant conversation, but it certainly has been a real honor for me to moderate among these four extremely knowledgeable people and to lay out the problems that we are facing, because if we don't lay them out, they may not get laid out, and people may try to either ignore them or deny them. So in just a very quick response to this last question, any final word of advice or idea that you want to share with our audience? And I'll start with you, Michel.
Apologies. I would repeat that I think our viewers and our audience will have understood that we are in an interdependent global world and our health is interdependent. So I call again on our friends in the US to re-engage in the international dialogue on health.
Thank you. Apoorva.
I think we've seen some unusual people step up. We've seen Saudi Arabia give money to polio eradication. We've seen Singapore want to be a bigger player. So I'm hoping that we will see some people who maybe have taken a backseat to the US in past years step up and fill the void.
That's a very hopeful note. Wafaa.
Yeah, I suspect there are maybe students who are listening to us today, whether it's students in SIPA or students in public health or students in journalism. And I do feel that it's really important that they take to heart the importance of this work moving forward, and they commit to trying to continue this focus on the population health, the focus on domestic health, but global health, and also to try to gain the skills that will enable them to contribute positively in these fields.
call to action for our students. I appreciate that, Wafaa. Jen, final word.
Final word. I also was going to do a thing on students and call on the public health schools and the schools to really support them right now, because they're looking ahead and thinking, why am I going into this career? We want them to go into this career. We need their energy and their expertise. But the other thing I will say is where we're going through right now is unprecedented, but the pendulum will swing at some point. So having the good ideas, having the reform ideas, and really taking to heart that things have to be different for all of this work to carry forward is really critical. So thank you.
Well, thanks to all of our panelists, both for participating today, but much more importantly for what they do every day to help to highlight these critical issues. And thanks to our viewers, and I hope we have provoked some thinking among all of you, and that each and every one of you will be trying to consider what you can do to help us deal with these very serious challenges. Thank you all very much.
Thank you.
Thanks, everybody.
Thank you.
Thank you.
Thank you.